So, from a medical perspective, why are all these new measures, relating to visitors with recent travel history to Hubei or even holding Chinese passports issued in Hubei recently, why is it necessary?
Well, thank you, Glenda, for the question. We've been looking at the global developments, and particularly in China, with considerable concern, and we've been watching the news coming out very closely. We've noticed that there have been a large number of cases now, both in China and overseas. There have been at least 4,500 such cases. But particularly in the last week or so, we've noticed an accelerating trend, a rising number of cases that's occurring, particularly in China. Most of the cases occurring are still linked to people who come out or have linked or traveled to Wuhan city. And we believe that there is evidence to suggest there's person-to-person transmission within the city itself. We are concerned because there's been a large number of people from Wuhan and the Hubei province that have also been traveling within China, and that perhaps might also account for the number of cases occurring elsewhere in China. And we also have these individuals also traveling to other parts of the world. We have, in fact, some of them also in Singapore. And all the cases we've seen to date in Singapore have, in fact, all been travelers, Chinese nationals coming out with a link to Wuhan city. So the concern is that if we continue just to watch the developments, we will see more cases coming. And when each case comes, there's always a concern of spread, either to their loved ones, close contacts, or even to the community. We're very fortunate that now, at this time, we have not observed any evidence of any community spread. But we're always watchful and mindful that that risk occurs. And therefore, given the developments, the concern that, in fact, there's a rising incidence, both in Singapore, which mirrors what's happening in China, it is prudent at this time to introduce enhanced measures above what we've, in fact, been doing to protect Singaporeans.
Each day we see the numbers of suspect cases awaiting confirmation, and these numbers have been changing. We know that the test results of at least 72 suspected cases, they're still pending. Can you explain to us why it seems to take a while before we can make confirmation of cases?
Yes. The test itself is, in fact, a test that can be done over several hours. But we don't rely on a single test in order to make a decision whether a person, in fact, is free of the infection itself. We are aware that when one test is done and it's a negative result, it may not necessarily conclusively prove a person is free of infection. And to be on the safe side, we wait for another day, repeat the test again, and it's only when we have got two tests that show a negative result, and when we are convinced that a person's symptoms from whatever infection he or she is having is, in fact, improving and that person is getting well, are we then confident to say that this person is, in fact, negative? That takes time, and it may sometimes take as long as 2 to 3 days.
Can you just quickly confirm, do you get false positive or false negative results?
It is a concern right at the beginning when a new test is introduced. And that is why the tests, in fact, are validated by our National Public Health Laboratory. And the tests, in fact, are therefore done on separate samples. In fact, sometimes the test is repeated on the same sample as well to verify that the tests are accurate. We've not seen false negative tests, and we're quite confident that the patients whom we have ruled out the infection are indeed free of that infection.
So, Kenneth, so far we know that there is no local transmission of the
That's
virus.
correct.
Even though some of the confirmed cases have been to public places and, been on public transport as well. Help us understand, what is happening there.
Yes. Well, the risk of transient contacts, and transient contacts would be described as perhaps someone you pass by in the corridor, or even if you're standing in the sort of distance I have with you, but for short periods of time, the risk of spread, in fact, is very low in that sort of setting. That's what normally we consider as transient contacts. But if you have a close physical contact and very close proximity for extended periods of time, that's where we would have a greater concern. And in patients who are indeed confirmed to have this diagnosis, this would be the people that we would then isolate, put on quarantine, and keep under observation. In a situation when you're traveling on public transport, the amount of time you actually spend within the transport and in close proximity to other people, in fact, is quite short. And the risk, therefore, of spread in that setting, in fact, is not high.
So how short is short? How long is long?
Well, that's no easy answer to give you a specific figure. And to some extent, it depends on a variety of different environmental conditions you're in. But it would not be unreasonable to expect that if you're in close proximity to a person for at least half an hour, that would reasonably be considered something more than just a casual contact.
That's worrying then.
One of the things that is perhaps reassuring to Singaporeans is the fact that we haven't had community spread yet.
Yes, that's
But it's
correct.
almost like we're holding our breath for this one. How likely is it that it's going to happen? And if it does, if that were to happen, how prepared are we for it?
Yes, well, the risk of spread is always a concern for us. Of all the cases that in fact have occurred outside China, until very recently, there was no evidence of human-to-human transmission outside China itself. And of course, today there have been some reports of perhaps some incidents where that might have occurred. But it's always a concern for us when a person has an infection that theoretically some spread may occur. We've been very fortunate that we've had very strong and good control, isolation measures, and therefore, at this point in time, we're confident that we're on top of things, in control of the situation. But the risk remains that community spread may occur, more cases will occur, and that is the basis why enhanced measures have taken place.
Well, I want to bring up, you mentioned that the isolation measures, basically they're in quarantine. So
Yes.
people who are in quarantine, help us understand what are some of the guidelines for when you are placed in quarantine and what's some of the, would we say, support that they get when they are in quarantine?
Yes. When a person is placed under quarantine, we give that individual quite a lot of instructions in terms of what he or she should or should not do. And we encourage them, in fact, to stay within where they're quarantined and not to mix with anyone else. In fact, we strongly discourage them from having contact with other people. We would contact them on a regular basis to make sure that they're well, they have no other needs that we can support them with, and also then to verify that they're in fact not moving away from their place of quarantine. We also carry out spot checks, and sometimes it's physical inspections as well, just to verify that in fact individuals are complying with the instructions for quarantine. And we've seen many people, in fact, all the people on quarantine so far being very cooperative with the measures put in place. Necessarily, when you're confined to a room or confined to the place where you're staying in, you have needs. You have to eat, you've got other needs as well, and we will support them for all of these needs as well.
So very quickly, if they break these quarantine guidelines, what happens then?
A quarantine order, in fact, is a legal order. It can be enforced by law. Those who break the law can be subject to a fine, and the fine is as much as $10,000. And if this is an egregious breach of quarantine orders, then a person can even be sent to prison for that.